Welcome to Black Health Matters. I'm Darryl Armistead, your host. This episode is a Zoom recording of Howard University group session led by Dr. Clive Callender.
Okay, today our special guest is Dr. Erlene Callender. She is a board-certified obstetrician gynecologist in practice for 15 years. She received her medical degree from the University of Maryland's School of Medicine in Baltimore and completed her residency training in Wright State University in Dayton, Ohio. Before entering the practice of medicine, Dr. Callender had a career in journalism. She graduated from Howard University with an undergraduate degree in print journalism. As a physician, she has used her journalism experience to raise awareness about important women's health topics. Dr. Callender is currently a candidate for a master's degree in public health at George Washington University. Welcome, Dr. Callender, and we have many people here assembled waiting to hear what you have to tell us today about how women should take care of themselves after they reach the age of 40 or 50 or 60.
All right. So yes, we're going to talk about women's health after the age of 50 or after menopause. So I'm going to share my screen. Okay, so can you see my screen?
Yes.
Okay.
Yes.
Okay, so unfortunately, a lot of women think that once they're done having children, they don't need to go see the gynecologist anymore, but that is not true. I am an OBGYN, so I take care of women in all stages of life during their reproductive years and beyond. So do women still need to see an OBGYN after age 50? Absolutely, yes. Just because you're not having children anymore doesn't mean you stop being a woman or need to stop seeing your OBGYN. So nowadays, women can expect to spend about a third of their lifetime after they've had menopause. So there's still a lot of time there for you to take care of yourself. And it's important to see your OBGYN regularly, so annually or at least every 1 or 2 years. And that annual exam includes, up to the age of 65, a pap smear, pelvic and breast exam, if necessary, screening for osteoporosis, and discussion about immunizations that might be necessary. And importantly, according to the CDC, many of the women who still need pap smears are not getting them. So 1 in 20 women between the ages of 60 to 70 has never had a pap smear. And as women get older, they're less likely to get this very important test. So some common issues for women in this age group include pelvic organ prolapse. That means weakening in the muscles that keep the uterus and everything inside. Also pelvic pain can be associated with this, pressure and urinary problems. Also, many women in this age group experience urinary symptoms like urgency or incontinence, which is trouble holding in the urine. They may have some chronic vulvar or vaginal itching, and they may experience pain with intercourse. And many of these symptoms are a part of aging, and many of them are related to the absence of estrogen, which is what we lose when we go through menopause. So this is just a diagram of some of the important GYN organs. So here you see this is the uterus, and inside there, the lining of the uterus is called the endometrium. On the sides, you have ovaries, 1 on each side of the uterus. The lower part of the uterus is called the cervix. Basically the tube that leads into where the uterus and cervix are is the vagina. And the external part, the parts that you can see on the outside, that's called the vulva.
Mhm.
So some of the cancers that we are concerned about throughout life, but that become more common as women age, are cervical cancer. I'm sorry, cervical cancer actually is less common as we age, but it is still something that requires screening. Ovarian cancer, uterine or endometrial cancer, that's the lining inside the uterus, vulvar cancer, and vaginal cancer. Vaginal is extremely rare. Ovarian is it's much more common and much more deadly. So we'll start with cervical cancer. It is one of the most preventable and treatable types of cancer. We have methods to prevent it because we discovered that it's caused by a virus, and there is a vaccine to prevent the changes that are caused by this virus. So screening tests, the pap smear, and the vaccine are very important to prevent disease. But in spite of this, many people don't get their tests, many people don't get their vaccines. And so in the year 2020, more than 600,000 women were diagnosed with cervical cancer and worldwide, and almost 350,000 still died from the disease. And like I said, this is a disease that doesn't have to happen. Each year in the United States, more than 4,000 women die from cervical cancer. 20% of these cases happen in women over the age of 65. Hispanic women are 60% more likely to be diagnosed and 30% more likely to die from cervical cancer than white women. And Black women are 80% more likely to die from cervical cancer than white women. So again, like I said, this is a disease that doesn't have to happen, and we definitely need to make sure we are aware of it and aware of what we need to do to prevent it. So this slide shows information about cervical cancer symptoms. It is important to say that the most common way to present is with no symptoms at all. But you may experience vaginal discharge or an unusual vaginal discharge, irregular vaginal bleeding, pelvic or abdominal bleeding after intercourse. And in the advanced stages, there may be a foul smelling discharge or pelvic and abdominal pain. So the guidelines for screening for cervical cancer include that up until age 65, every woman should have a pap smear every 3 years, and that's what we call cytology. Also, there is the option to get tested for HPV, which is the virus that causes the changes that lead to cervical cancer. And you can have HPV testing alone every 5 years or both. So the pap smear plus HPV testing every 5 years. Now, after the age of 65, no further screening is necessary as long as the woman has had negative results in the past. For women who've had a history of cervical cancer or something close to cervical cancer, they still need to continue screening. After a woman has had a hysterectomy, which means removal of the uterus and the cervix, they don't require screening any further, again, unless they have a history of cervical cancer or something that's close to cervical cancer. So ovarian cancer is what we'll talk about next. And again, the ovaries are the organs that you have 2 of them, 1 on each side of the uterus. And these are the organs that are responsible for the estrogen. So after menopause, that's when they stop working and we don't get as much estrogen. Unfortunately, this is the number 1 cause of deaths from GYN cancers in the United States. About 20,000 women in the United States will be diagnosed this year, and about 13,000 women will die this year. Risk factors, age over 55, so it does get more common with age. Family history of breast cancer, ovarian cancer, colon cancer, or endometrial cancer. A personal history of breast cancer. And there are certain genetic mutations and syndromes that can lead to a higher risk of ovarian cancer. You may have heard of the BRCA1 and 2 genes, or the BRCA1 and BRCA2 genes. And there's also a genetic syndrome called Lynch syndrome that makes ovarian cancer more common. Never having had children is a risk factor. Having a history of infertility and a history of endometriosis also can be risk factors for ovarian cancer. So ovarian cancer, so these are just some things to point out. Many people are aware of the pap smear, but it's important to know that the pap smear is a test for cervical cancer, a screening test for cervical cancer. It does not apply to ovarian cancer. So it's wonderful if you get your pap smear every 3 to 5 years, but just understand that that's not a screening test for ovarian cancer. Ovarian cancer, because it is mostly silent, is diagnosed most often at a later stage. But diagnosing it early is how we can save more people. So there are some common symptoms, but they are pretty vague. These symptoms include abdominal bloating, difficulty eating, feeling full very quickly, pelvic and abdominal pain, or urinary symptoms. Again, there's no screening or diagnostic test for ovarian cancer. And this is just displays some of the signs that you might notice for ovarian cancer. Now, having the symptoms, of course, they can be associated with many other things, like fatigue. I mean, there's many reasons we're fatigued. But if you notice something that has gotten worse over the past 2 weeks or so, and you just can't, figure it out, it's definitely important to go see your doctor. It may not be ovarian cancer, but one of the things with ovarian cancer that we've noticed is that women complain about symptoms for maybe a year, it turns out, before they're diagnosed with ovarian cancer. So if you feel like something's just not right, definitely it's worth it to talk to your doctor about it. So like I said, it's most often asymptomatic, unfortunately. And the symptoms that we discussed are pretty vague and can be associated with a variety of health issues, but it's definitely important to see your OBGYN if you have any of these issues for 2 weeks or more, and get a pelvic exam and maybe an ultrasound. So now we'll talk about uterine or endometrial cancer. So again, this is a picture of the uterus, and the inner lining here of the uterus is what's called the endometrium, and that is where endometrial cancer would happen. So this is the most common type of GYN cancer. Most cases are diagnosed in women who are beyond menopause or in their mid-60s. It's the 4th most commonly occurring cancer in women. Age-adjusted mortality is 84% higher in Black women. More than 65,000 new cases will be diagnosed this year, and about 12,550 women will die from ovarian cancer. Endometrial cancer this year. So the risk factors, again, this risk increases with age. Obesity is a risk factor. There are genetic syndromes that make endometrial cancer more common in some groups of people. A history of polycystic ovarian syndrome, when the woman was having her periods and cycling. A history of breast cancer treated with tamoxifen. Starting your period at a young age or going through menopause at a late age is a risk factor. So basically, having more periods in your lifetime is a risk factor, and never having been pregnant as well. The most common symptom is postmenopausal bleeding. So menopause means going 1 full year without having a period. And if that happens, any bleeding that occurs after that is abnormal. and you should go see your doctor about it. Okay. Symptoms of advanced endometrial cancer include abdominal or pelvic pain, bloating, feeling full quickly when eating, or changes in bowel or bladder habits. Again, some pretty vague symptoms, but still things that you should watch out for and go see your doctor if you have them. And again, any bleeding that happens after menopause is something you need to see your doctor about. So vulvar cancer. So the vulva is the part of the reproductive organs that we can see on the outside. And this cancer has symptoms that include like intense itching or burning that doesn't go away, a lump or sore, swelling or growth, a change in the skin of the vulva. That could be that the texture changes or the color changes. You might have a mole that changes in color or shape, or another lesion or sore, or you might notice that the lymph nodes in that area are hard or swollen. So if you do have any of these symptoms, go see your gynecologist. There is no screening test for this cancer. The average age of diagnosis is 68. Again, some of vulvar cancer is caused by human papillomavirus, which is also what causes cervical cancer. And so the HPV vaccine can help prevent vulvar cancer from happening. So risk factors, again, age, the risk increases with age. Smoking increases the risk. Having a suppressed immune system increases the risk. And having an existing skin condition involving the vulva, like lichen sclerosis. Because the vulva tissue is skin. So you can have skin conditions there like you can have on other parts of your body. But if you have something that's new, you definitely want to see your gynecologist about this. So vaginal cancer, again, this is a diagram, and we're talking about here, the tube that goes into where the cervix and uterus are. This is a much more rare cancer with about 5,000 new cases each year. Again, the average age at the time of diagnosis is 67. And this is another cancer that's caused by the human papillomavirus. Symptoms can include blood-stained discharge, bleeding after sex, pelvic pain, mass in the vagina, difficulty urinating or noticing blood when you urinate, and also pain in the rectum. So those are many of the things that we need to be aware of as we age. And but it's important that we do continue seeing the OBGYN beyond the age of 50. Any questions?
Thank you for that excellent Thank you for that excellent presentation. You have a number of women who are here specifically to hear you today. So,
oh, great.
So let's hear the questions.
Yeah, I have a question.
Of course.
You know, I think it was ovarian cancer you were talking about in regards to, you know, there's not really that many signs of it other than like a bloating stomach and you say it's more common with women that didn't bear children.
Right.
How much more common is it?
How much? That's a very good question. It's sort of like when I said about an endometrial cancer, like the more periods you have in the lifetime, then it's more common. So what we're thinking about, and with a lot of cancers, the more our organs have to work, the greater chance there is that something might go wrong. So like with the ovaries, every month we go through a certain cycle, the menstrual cycle. And the more times we do that, the more risk there is of something going wrong. the common or modern women, we have contraception and we have much more control over our reproduction. So there's much more, women have more periods than they used to when all we did was have babies. We didn't
Right.
work or anything like that. We just had babies. So we started our period, we had babies, and we had menopause, and then we died. And that was basically our lifespan. But nowadays we can control that more. So I don't know the exact number, but it's much more common. And even, I'm sorry.
And how often should that be checked?
Well,
I'm saying that because with COVID, a lot of people aren't going to doctors.
that is
And
a really good point. You're exactly right. A lot of people have not been going to the doctor, and that is a problem. You know, they have found that there are things that have been missed because of that.
Right.
But women should see their gynecologist anytime something is wrong, but on a regular basis, every 1 to 2 years.
Mhm. Okay, thank you.
Sure.
Thank you for
Okay.
that presentation. My question is, are you related to Dr. Clive Callender?
What do you think?
So,
They have the same laugh, I can tell you that.
You spit her out. Absolutely.
Yeah.
Same smile, same nose.
Same smile, yeah. I
Yes.
can't deny it. Yes, he's my dad.
Dr. Callender, thank you. A great presentation. Can you discuss fibroid tumors?
Yeah. So fibroid tumors, I'm glad you asked about that. Those are very common tumors. I think they're very common and they're benign. So the word tumor, sometimes people get worried about it, but these are probably 1 in 3 women. So most of the women you know probably have fibroid tumors. They, for some women, can cause a lot of problems like heavy bleeding, pain with their menses, or just pelvic pain. They can become very large and cause pressure, and even so large that they cause problems with the bladder or with the rectum. But many women are walking around with fibroid tumors and don't even know about it. So there's a wide range of how they can affect our lives. Generally, once menopause occurs, they will not continue to grow. And it's extremely rare for them to become cancerous. But like I said, if they are, if it's beyond menopause, they shouldn't keep growing because they are supported by estrogen, and that's decreased after menopause. So if something like, if you have a mass that grows after menopause, then that's definitely something to be concerned about. But if your doctor tells you you have fibroid tumors, it's not necessarily, it's only, they're important because of how they affect your life. So if you're not having pain, you're not having irregular bleeding, you're not having any symptoms due to just having an enlarged uterus, then just having them is not going to harm you.
Dr. Callender, where do the fibroids occur?
Okay, sorry. The fibroids are, they are masses that occur in the uterus. So it's sort of like the muscle, the uterus is made of muscle. And it is a mass that develops in the muscular tissue of the uterus. I can share my screen again and get so this is the uterus here. And the fibroids can occur at any place inside this muscular tissue. And they can be inside, they can be outside, but still associated with the muscular tissue. And they can even be inside of the cavity.
Thank you.
Mhm.
Dr. Callender, I have a question. When you do have those fibroids, what would be the reason for having your uterus removed?
If they are causing lots of problems. So if a woman has fibroids that are causing her to have pelvic pain, heavy bleeding, difficulty with bowel movements, or causing problems with her bladder, or if it's after menopause and it continues, it keeps growing, then that would lead to a woman maybe making the decision to get a hysterectomy.
And a follow-up question, if the uterus has to be removed, would the fallopian tubes and ovaries have to be removed as well, or they can stay?
These are great questions. So hysterectomy generally means that your uterus is removed. So the uterus and the lower part, including the cervix. It can be removed by itself. And it also, you also can remove the fallopian tubes and ovaries as well. That is very dependent on the reason for the hysterectomy, the patient's wishes, and her age. So if a woman is still having her periods, she would want to keep her ovaries so that she could maintain that estrogen. If it's beyond menopause, it's most common that we would remove the tubes and ovaries as well. Cancer can also happen in the fallopian tubes, where it's thought that there is specific fallopian tube cancer, but it's thought that some ovarian cancer starts in the fallopian tubes. So generally, if we remove the ovaries, we remove the tubes as well. But women can have a hysterectomy and they can have just the uterus removed and have the cervix remain. They can have the ovaries remain. So there's different ways to do it. And it would be, that decision would be based on the patient and her doctor and the reasons for the surgery and the age of the patient.
Okay, well, thank you for that.
Of course.
Do you have any opinions as to why rates of GYN cancer are higher for women of color?
Yes. I mean, I think it's racism. I think that's one of the main reasons, as we have seen in so many other areas. I think that Black women and Black people don't get the proper treatment for many things. So, I mean, it's complicated. There may be lack of knowledge amongst, a lot of women about the fact that you need to go to the doctor still after menopause and about what signs and symptoms to go see the doctor about. In one of the, they've done studies that show that women with ovarian cancer have sometimes complained of important symptoms for a year before they were diagnosed with ovarian cancer. So sometimes women may not be listened to or taken seriously. And that's especially true for Black women. So it's mostly social issues, I think, that contribute to that.
Dr. Callender,
Yes.
thank you for clearly, and I'm saying that everything you said just kind of related to me and my family. And right off the top, you talked about Pap smears and age 65.
Mm-hmm.
And I'm one of those who have not since 65. And you're saying it's okay. I mean, I do have my other checkups and I'm very thorough about my health. So I have a family member who has been telling me, you've got to do this, got to do that, as far as this Pap smear. And I gathered from today, it's not detrimental unless you had previous issues prior to that age or had bad pap smears in the past.
Right. So one thing I want to point out, I have noticed that many people don't know what the term pap smear refers to.
Mhm.
For a lot of women, when I talk to them, if you say pap smear, they really think that encompasses anything involved touching the vaginal area in an exam. So when they say pap smear, they may mean a pelvic exam complete overall, so your family might be thinking that you're not getting any kind of examination whatsoever. But a pap smear is a specific test for cervical cancer, but it's such a common thing that we all know and recognize that it's not always, I'm not sure that every woman understands what it means. So an exam is important every 1 to 2 years for the rest of your life as a woman. A pap smear, the specific test for cervical cancer, is not necessary after 65 if you haven't had any, if you've had recent negative tests and if you haven't had a history of cervical cancer or a high-grade lesion on your cervix.
Yes. Also, I had a sister who had ovarian cancer, and she found out the hard way that that's one of the more difficult cancers to diagnose. And she had been going to a doctor for years, for a year, complaining about certain symptoms. And I think with that bloating, the doctor took it as her being overweight, and she kept trying to exercise, diet, and that just did not work for her. She went through the BRCA testing, which was important to the female family members, and she didn't carry that gene. It was quite late when they diagnosed her cancer. Unfortunately, she's not here now, but she passed from a brain aneurysm. So again, that part of your presentation hit home. I have another question.
Mhm.
When you speak of hysterectomy, and sometimes they use the word a complete hysterectomy, sometimes with a hysterectomy, the ovaries are not removed. And I've been told that if they remain after a number of years, they disappear.
No,
Does that make sense?
they don't disappear, but you have to think they're not working anymore. So they may become very difficult to see on an ultrasound. They generally become smaller because they're not in use, but they're still there. They're not doing the work that they were doing before menopause, but they are still there.
Just difficult to identify.
Yeah.
But they, okay. All right, good. Thank you.
Yeah, of course.
Dr.
Dr.
Callender, also, I enjoyed your presentation. I do have a question for you concerning birth control.
Okay.
If you are taking birth control, whether or not it's a medication or whether or not it's a device, could they be a contributing factor towards any of the cancers that you have discussed?
Actually, it's beneficial. So like I said, the more periods a person has, the more work your ovaries and the endometrium are doing, the increased risk of cancer. But using birth control, like birth control pills, is actually protective for ovarian cancer. And it's actually something that is recommended in families with a strong history of ovarian cancer. So generally using birth control pills and basically stopping ovulation is beneficial as far as helping to prevent or decrease the risk of GYN cancer.
Thank you.
After a complete hysterectomy, how much of a risk is estrogen replacement?
After
What's the
after a
risk?
hysterectomy with ovaries removed, estrogen replacement is indicated for helping women with the symptoms of menopause. So it's important that it started early when a woman is going through menopause, and that it's used just as long as she needs it to help with those symptoms. But without a uterus, without ovaries, it's very safe to use hormone replacement. It becomes more complicated when you do have a uterus and ovaries, because the estrogen, can do what it normally does, which is make you have a cycle. It makes the lining of the endometrium thicker, and your ovaries would still be active. So it's safe, but you definitely want to be mindful of the difference whether a woman has her organs or not. And we always want to try to use it for the shortest or the lowest amount for the shortest time necessary.
Dr.
Callender. Go ahead, Sylvia.
I'm sorry, Dr. Callender, regarding estrogen for those over the 60, 65, you indicate there could be problems with sexual issues. Is there anything that can be given or used to increase estrogen for those over 65?
Yes. Again, it depends on what you're using it for. So if you're having vaginal dryness, itching, pain with intercourse, you can use estrogen vaginally, and that will dramatically improve the texture of the vaginal tissues. So you can there's creams and gels, and there's a ring, and there's lots of different ways to apply it, but you can use it locally rather than taking a pill. And that also can help with some urinary symptoms too, like incontinence.
Oh, okay, thank you.
Dr. Callender,
Yes.
is it or should a woman, as she ages, use the estrogen? I had a doctor when I was going through menopause. He was an older doctor, and he didn't believe in giving estrogen. He said the human body is supposed to take care of itself. And so I have never taken estrogen. So am I maybe at risk for something, or?
No, you're fine. You're fine. So estrogen is a wonderful thing, right? It's what makes us women. It makes our organs, work. It makes, it does a lot of things. And once you go through menopause, you realize when you lose it, you realize, a lot of the benefits that you experience during your lifetime. So it's something that our bodies make. It's natural. It's not anything to be afraid of. It can help. Some women suffer terribly when they're going through menopause. They can't work, they can't sleep, they can't function. Other women, it doesn't interrupt their lives at all. But for women who suffer, then estrogen replacement is incredibly helpful. So, you don't need it, because it's true. Your body, all of these are normal processes, right? Like menopause is a normal process. That's what happens. It's normal. But, there are lots of normal processes that are unpleasant. Many people just having a period can be extremely painful, or have extremely heavy bleeding, but you don't have to suffer through it. You can get help. You can take medications, you can do things that can help you through that. And it's the same with menopause. It's a natural process, but you can get help to get through that transition. And the most helpful thing is estrogen. There are other ways to do it. Because, of course, people who have a history of breast cancer or some cancer that is responsive to estrogen, they don't want to take estrogen. So there are other options, medical options to help with those symptoms. But if you've been through menopause and you've survived and you're doing okay, then you don't need to worry at all about the fact that you never took it. It's perfectly fine.
Yeah, I was one of the fortunate women. I didn't have a problem during my period years.
Yeah, and that is fortunate. I mean, a lot of people suffer greatly,
I've
and
known plenty of my friends who had to go to bed, some of them. And
yeah,
I never had that problem. So
yeah.
I also wonder whether I had children young.
Hmm.
So I wondered whether that helped it or, you know,
Yeah, it might have. That's true.
so, okay.
Dr. Callender, I have another question. How does the lining of the uterus works itself out of the uterus? I asked that question because I had a niece who had some surgery and unfortunately something went wrong and she passed. But how does the lining of the uterus works itself out of the uterus?
You mean out of it to where? You mean out of your body?
Out of, I guess, where the lining of the uterus. I think they'd indicated, my niece had indicated that it was the lining of the uterus was outside of the uterus,
Oh,
endometriosis.
endometriosis.
Yes.
Okay, so we have theories about that. We don't know absolutely for sure, but we have theories. One of the theories is that just the way that it comes out when you have a period, sometimes it can go in the other direction and be distributed out into the pelvis rather than coming out through the vagina. But yes, endometriosis is a condition where there is endometrial tissue outside of the uterus, and that generally can cause pelvic pain. It can cause regular bleeding. It can cause infertility. And many people will have surgery to help with that, but also hormonal treatments are possible. But it's quite fascinating. We don't know exactly how it happens, but we definitely can see it. But yeah, that's what endometriosis is.
Okay, this niece was about 35 years old. And as I said, something went wrong during the surgery and she did pass.
Oh, I'm sorry. Sorry.
I've got a controversial question. Do you think it's more likely to get bad gynecological advice from a male gynecologist?
I don't personally. I don't. No, I don't. I mean, I think we're all trained the same. I think that, generally women are just smarter, right? But
Oh.
but as gynecologists, we all are trained the same, and we should know the same things. I personally don't really mind if I have a male doctor or a female doctor. I expect them to be professional and to take care of me either way. I think it's different now because now more OBGYNs are women than men. But like when my mother was growing up, they were all men. And I do just from talking to patients, I notice a very a dramatic difference. There's a lot of women of a certain age who were taken care of by male gynecologists when they were all males. And you ask them why they had a hysterectomy, and their answer is because my doctor told me I needed one. So I think there was a time when it was much more patriarchal, and it was much more, you need this, period. Not let's discuss what your options are, but you have this problem, this is what you need, let's do this. So I don't know, I'm not necessarily saying that that's because of, men, but it has changed as women have become more common as OBGYNs.
Dr. Callender, I agree with you there. Because men have a tendency to sometimes dismiss women if you're feeling a certain way or an et cetera, and they pay attention more to each other. but I'm going to another subject. How many doctors, and I'm asking this from a personal viewpoint, they say you should have a primary care doctor. A woman should have a primary care and gynecologist too. And then our men are supposed to have two also, primary care and whatever the doctor is for the prostrate, urologist. So should women have urologists, or how many doctors should an average person have? Because I thought after I reached a certain age, I didn't need a gynecologist anymore, especially after childbearing, or if you have a hysterectomy, I just needed a primary care. Then if I couldn't see, I needed optometrist, and if I couldn't hear, that. But I just thought you just needed a primary care, and if you found something else wrong with you. But he never said go to a gynecologist, my primary care. So you're telling me something different.
Yes, I am telling you something different, and I want you to tell all your friends something different. Because I think it is very important for women to continue seeing a gynecologist, even after they're done having babies, even after they've had a hysterectomy. Because like I said, besides the hysterectomy, you still do have organs that can cause you problems. You might have vaginal issues or vulvar issues. When you go to your primary care doctor, do you take off your clothes?
Heck no.
Exactly. So when you go to your gynecologist, you're going to take off your clothes, and that person is going to look at things that the primary care doctor will never look at, so just the fact that, think about it, you can't, he or she, your primary care doctor, can't see something that's there if you're fully dressed, right? It's important to go to a primary care doctor. Some women will use an OBGYN as their primary care doctor. But if you have problems like high blood pressure, diabetes, you do need to see a specialist, or at least a primary care doctor, depending on how severe it is. But there's more that needs to be examined than just like listening to your heart and lungs and checking your blood pressure. There's more that needs to be examined. You should have a breast exam. You should have, a lot of women will need a pelvic exam. You may not need a pelvic exam every year, but you may have some symptoms that you want to discuss. And those, if you may present those to your primary care doctor, and he will think of it one way, and a gynecologist will think of it as a completely different way. For one example is, you may have vaginal or vulvar itching. And again, without taking your clothes off, your primary care doctor may say, oh, you have a yeast infection, and give you medication for that, right? And I've met women who've gone like a year treating vulvar itching as a yeast infection, and they turned out to have vaginal or vulvar cancer. Nobody ever looked until they came to the gynecologist. So simple things like that, like you might think it's simple, I just have some itching down there, I just need to put some cream down there, but I think it's important to look.
Are there any gynecologists that do it all? Just go to one doctor?
Yes, but like I said, you can use your OBGYN as your primary care doctor. But if you have some medical problems that need to be attended to, you probably need someone who is a specialist in that area. Do you know what I mean? Like, we're not gonna manage your diabetes. We will do all the screenings and things, and we'll check your blood work and check your thyroid, and we'll do all those things. But if you turned out to have like hypothyroidism, then we will need you to go see someone else about that.
Okay, and this question is irrelevant. Under the medical training, the primary care is like what you said, they don't touch you. Is there a rule or law that they can't touch you anymore? And then they gotta have a
They're supposed they're supposed to touch you
and act like you got cooties or something like that. They stand far away, ask you all these questions, and then say, here, go there. But
I think the senior Dr. Callender will agree with me that you are supposed to touch your patients. Yes. You cannot examine a patient from a across the room or over the telephone. You just
Or they
can't.
ask permission, can I check your heart permit? I mean, it used to be, they just said they're gonna check you and they check you and you just, but now everything is permission with rubber gloves. They just act like you're diseased or something when you go in
I
there.
think it's polite to say I'm about to, you know, check your, I mean, I tell people when I'm about to touch them, just to be polite. But I feel like I go to the doctor, I expect to be touched. I expect them to do something, you know, with their hands. But I personally, I have, this is what I've learned from my patients. Like when I talk to them and I ask them about when they saw their primary care doctor, and they'll say, well, I saw my doctor about this, that, and the other. And then I'll find out that they never took off their clothes, you know, and they know whatever, that doctor never looked at anything. So it's one thing if you're just coming to the doctor to get a blood pressure check or to talk about your diabetes and you just need to talk about your blood sugars. But for a regular exam, the idea is that when you go for a routine exam, if something is wrong that you don't know about, that's when it would be found. Do you know what I mean? And they may pick up on things that you tell them that you wouldn't realize are important. So the idea that you go to the doctor and they never touch you is bizarre to me.
I agree with Carol. The doctors, my primary care, and she's a woman, but my primary care doctor comes in with her laptop. She does a few things on the laptop. That looks okay. This looks okay. Schedule your next appointment. And because of that, because back in the day, a few years back, my primary care, I would get up on the table. They don't do that anymore. Primary care. So my thing, I'm relatively healthy, thank the Lord. I haven't seen my primary care doctor in 2 years, and not because of COVID.
Did you feel like it's a waste of time?
Amen.
I think it's the individual doctor. I think it's your doctor.
I'm listening to you, and neither have I seen a gynecologist in a long time. I'll be 78 this year. It's been a long time since I've seen a gynecologist.
Please go.
So
At 78,
I feel like at least listening to you, they will look at me and maybe see something that
Right. Right.
Because the primary doctor just does not.
Yeah.
I think it's your doctor. I have a primary care doctor and I've been going to him for a number of years. I'll also say I had a GYN that I actually loved. I hadn't been to a GYN since I was 65 and I'm 72. I see my primary care doctor on a regular basis. He does touch. We do talk. Actually, I see him twice a year. Actually, every 4 months, he has me coming in, checking my blood, and he knows more about me than I do. When's the last time you saw Dr. So-and-so? What happened to that thing on your leg? I say find another doctor. I think they should touch.
Yeah.
They should look.
Yeah, they should care.
Maybe I should still be seeing a GYN. He'll ask about it. Is it okay? Do we need to do anything? That's one area of the body itself. Otherwise, he's there 100%. And he truly believes in referring me to a specialist for the least little thing.
Right.
So I think you need to rethink your medical treatment. I think at our age, we need to have someone who's thorough. At our age, anything can happen.
Exactly. Yeah. And there is a wide range. Like you're saying, your doctor is very different than her doctor. There's a wide range. Like I go to a primary care doctor who does my GYN stuff as well. And you know, that's the doctor I found. So there's a wide range, and you should find someone that you feel comfortable with. Find someone that you believe cares about you, and is worth your time.
Dr. Callender, I had a couple questions about the pap smear.
Okay.
Is the pap, is that short for papilloma?
No, it is.
No.
It's short for the name of the person who invented it. Papa Nicolau
Okay.
is his last name.
And do women have a history of fear about that? Is there something uncomfortable about having a pap smear? What's the big deal?
Okay, so let me see. Let's maybe I'll show a picture.
And then after that, Dr. Callender, Elizabeth has a question.
Okay. So how do I do this again? Okay, share screen. Okay, so this is this is our bodies. This is the vagina, and this is the cervix. So the tissue for the pap smear comes from the cervix. So that means we have to go into the vagina. We have to open the vagina and get cells from the cervix. So it's not, it's uncomfortable. It only takes a few seconds, but it's uncomfortable. So we use a speculum to open the vagina so that we can get to the cervix. It's not, I wouldn't say it's a big deal. Women, go through a lot worse things. And like I said, it doesn't last very long. But yeah, a lot of women, I mean, we're up there with the dentists for the doctors that people want to go to the least. So it's not pleasant, but it's quick, and it's not the worst thing.
Question, another question. Do your instruments have to be so cold?
No, they don't. They really don't. Honestly, we have machines, I guess, or device things that keep things warm. We do. Some doctors do, some doctors don't. Some doctors, like, how there's that, you lay on that table and there's drawers in there. That drawer might be a warming drawer. Some doctors will wet the speculum with warm water before they use it. So you can say that to your doctor. You can say, does your stuff have to be so cold? And maybe they can warm it up for you, or not every doctor thinks about these things. A lot of times, and this is understandable, we're trying to get through the day and see everybody and take care of everybody, and some things like that are important to you may get missed. But if it's important to you, speak up.
I'll definitely ask. Thank you very much.
Mhm.
I had a question. This may be the last one because we almost at 10
Elizabeth
o'clock.
has a question too.
But the question is, actually, Darryl asked a question about estrogen. And it's still controversial as to whether or not taking estrogen is related to breast cancer. What are your thoughts about that?
I think the studies are pretty definitive about that estrogen is safe for most women to take. If a woman has a history of breast cancer that is responsive to estrogen, then she shouldn't take estrogen. But for most women, especially those who've had a hysterectomy, it's perfectly safe to take. And as with most medications, we try not to overuse it. We try to you start out with a low dose and you see what the patient needs, you see what works for the patient, and then you try to use it for as short time as is necessary. But it's unfortunate that this idea that estrogen causes cancer is still out there, because it really can help a lot of women, and they don't even consider it.
Elizabeth's hand's been up for a minute.
Sorry, go ahead.
Again, good morning, everyone. Good morning, doctor. I like to, I think you've covered this, but I want to make a comment and then I'll get your response on. Now, I know as part of the recap, you said that we who are over the 65 should have a pap smear every 2 to 3 years?
Over 65,
right?
over 65, you don't need it anymore. If you've always had negative pap smears, if you've had a history of cervical cancer or something close to that, then you will still need to continue. Otherwise, over 65, you don't need it.
Well, I'm a preventive care person. I always try to think of preventive care. So over 65, thank God. So you're saying I don't need it, but okay, Medicare, okay, most of us over 65 gets Medicare. And Medicare has a list of preventive services that they will pay for. So we don't need it, but for preventive care, what do you suggest?
For cervical cancer?
Vaccine.
No, just for.
Because the pap smear is a specific test for cervical cancer.
Right. Well, all our lives, up until a certain age, when we became adults, we've been getting pap smears. So now here we're past 5, and the reason we got them was because of the fact that preventive care, okay?
Preventing cervical cancer. So the risk of cervical cancer actually decreases as you age. Cervical cancer is caused by a sexually transmitted virus. So it's much more common in, number one, women who are sexually active, and number two, women who have new partners are much more likely to get exposed. The data shows that the risk decreases after a certain age, and that because the human papilloma virus is so slow progressing, if you were to get like a mild change in your cervix caused by HPV at the age of 65, it's most likely not to cause you any problems, because it takes many years to go from a minor change to cancer to death. So the data does not support continuing it because it's not going to change any outcome. Now, you definitely should do other things for preventive care with respect to your reproductive organs. And that includes seeing a gynecologist every 1 to 2 years, getting an exam by your gynecologist, talking to them about any issues or symptoms that you're having, getting a mammogram, getting your colonoscopy, getting your immunizations. All of those things are preventive. The pap smear, again, is a specific test for cervical cancer. And because of what we know now about cervical cancer, we've determined that the benefits are minimal to continue doing it after 65 for women who have had normal pap smears. That makes sense?
Thank you.
Thank you very much for incredibly.
Somebody about the vaccine.
Oh yeah, so it's a sexually transmitted virus.
What was it about the vaccine?
The HPV vaccine can prevent cervical cancer. It is indicated in children and adults up to age 45.
Okay, did they consider nursing homes where there's more venereal disease than anyplace else? Or is that just a myth?
I guess, if you're living a lifestyle where you might get exposed to HPV, it's something you want to consider. But again, it's a very slow progressing virus. So that, even if you're like 80 years old and you were to have an abnormal pap smear, you're not going to die from cervical cancer, most likely. It's just not going to work. It doesn't work that fast.
Well, thank you very much. It's 10 o'clock and you've done a great job and you've answered so many questions. It's amazing. You've done an excellent job of presenting and answering the questions so well, and we appreciate it very much.
Thank you. Great to be with you guys. You had great questions.
Thank you very much.
Thank you. You guys have a great day.
Okay.
Thanks, Doc.
All right.
Bye.
All right. Darryl, can we see that 50-minute videotape?
Okay, let me cue it up.
Hey, what's up, guys? Tino.
Almost there. Okay, where'd it go? There we go.
Hey, what's up, guys? Tino here, and today I'm interviewing Dr. Milton Mills to talk about dairy and whether we should be consuming it. So many people are now transitioning away from dairy and going for alternative calcium sources. So let's jump right into the interview and get into the topic.
According to current theories of the evolution of Homo sapiens are felt to be, that is modern humans, to be about 100,000 years old. The earliest known evidence for the use of mammals for their milk is as old as 6,000 years in certain areas of the world. But in Western European countries, it's about 3,000 years that we have good evidence for the use of dairy foods. Human beings, again, according to evolutionary theory, existed for almost 100,000 years before we started using other mammals for their milk. So clearly, we don't need it. And it's really absurd to argue that any mammal needs to drink the milk of another species. That's just absurd on its face. Milk is a secretion that female mammals make that is designed to feed their babies. Nature, God, whoever you want to pull into this conversation, never intended that as adults we would be drinking our own milk, let alone the milk of another species. The way I look at it, I'm sometimes even reluctant to call milk food. I mean, it's a material that we can ingest. In my mind, it's like using some recreational drug. I mean, it's not necessary. Yeah, it's optional, but it's not something that you have to do or that you need to do. And humans do not have to drink cow's milk or goat's milk or sheep's milk, and it doesn't supply any nutrient that we can't get elsewhere in our diet. Worldwide, the vast majority of humans are lactose intolerant, as are essentially all mammals. The sugar that is in mammals' milk is called lactose. But what lactose is, it's what's called a disaccharide, meaning it's two individual sugar molecules that are linked together into one molecule. Our bodies can only absorb single sugar molecules. So in order to be able to absorb lactose, you have to make an enzyme called lactase that actually splits the lactose molecule into its two individual sugars, glucose and galactose. All infant mammals make tons of lactase because, of course, they have to be able to absorb the lactose in their mother's milk. But as mammals mature and are weaned, their bodies stop making this enzyme. And it makes sense because enzymes are very large proteins that require a lot of intracellular machinery to actually create and then position in the digestive tract so that they can do their function. It makes no sense to continue making an enzyme that you really don't need. And since all mammals except humans stop drinking milk once they're weaned, all mammals stop making lactase as they become mature. That is also true for the vast majority of people around the world. The only people who have become what's called lactase persistent
Pause the tape. Pause the tape.
John, you said pause the tape?
Yeah, because the sound went out. The sound went out.
Oh, okay. Not sure why. See
Do
if
you
the
still-
sound is there.
Do you still heard it?
Yeah, I heard it.
What about someone else? Speak up.
I didn't. I didn't.
Oh, the sound went out.
The sound went out.
The
Sound went out. Mhm.
Oh, I know what happened. I'm sorry.
Sound went out.
Uh, okay. It happened because I muted my mic is the reason why the sound went out. So I just won't mute my mic and you'll be able to hear it.
For their milk. So clearly we don't need it. And it's really absurd to argue
Can you hear it
that
now?
any mammal
Yes.
drink the milk of another species. That's just
You
absurd
gotta
on
go
the
forward though to where we were.
nutrition that female mammals make as adults. We would be drinking our own milk, let alone the milk of another species. The way I look at it, I'm sometimes even reluctant to call milk
Now,
food.
can you move forward to where we were
In my
in
mind,
time?
but it's not something that you have to do or that you need to do. And humans do not have to drink cow's milk or goat's milk or sheep's milk, and it doesn't supply any nutrient that we can't get elsewhere in our diet. Worldwide, the vast majority of humans are lactose intolerant, as are essentially all mammals. The sugar that is in mammals' milk is called lactose. But what lactose is, it's what's called a disaccharide, meaning it's two individual sugar molecules that are or single sugar molecules. So in order to be able to absorb lactose, you have to make an enzyme called lactase that actually splits the lactose molecule into its two individual sugars, glucose and galactose. All infant mammals make tons of lactase because, of course, they have to be able to absorb the lactose in their mother's milk. But as mammals mature and are weaned, their bodies stop making this enzyme. And it makes sense because enzymes are very large proteins that require a lot of intracellular machinery to actually create and then position in the digestive tract so that they can do their function. It makes no sense to continue making an enzyme that you really don't need. And since all mammals except humans stop drinking milk once they're weaned, all mammals stop making lactase as they become mature. That is also true for the vast majority of people around the world. The only people who have become what's called lactase persisters, and that is they have a genetic mutation that causes them to continue making lactase throughout their lifetime, are people who hail from an area in the world where the practice of dairying, using the milk of other mammals for food, was common. In Northern European countries, there's a very high percentage of people who are lactase persisters. And there's also certain East African tribes that have traditionally had a sort of pastoral economy where they used milk, and they are also lactase persisters. But everybody else, just floridly lactose intolerant. And that's really emphasized in this country when you look at people of color. The statistics are as follows. 95% of Asians are lactose intolerant, 74% of African Americans, 70% to 73% of Native Americans, and 53% of Hispanic Americans are lactose intolerant, as opposed to Caucasian Americans, where lactose intolerance is only about 33%. Amongst African Americans, if there hadn't been the sort of rapes of slave women that caused the mixing of European genes with West African genes, prevalence of lactose intolerance would be even higher than the 74%. But clearly, the majority of people of color are lactose intolerant. Again, that's true around the world. And that is why I helped co-author a paper where I talked about institutional racism in the U.S. dietary guidelines, because the U.S. dietary guidelines, which are put out by the Department of Agriculture, not Health and Human Services, recommends that people eat dairy foods. And they recommend this knowing that if people of color consume these foods, they're going to get sick. But what's worse is that there really is no benefit to consuming dairy foods. Now, the number one reason dairy foods are touted is supposedly they are the best source of calcium. But the problem is that dairy calcium, in the majority of studies that have been done on it, has not been shown to be protective against osteoporosis, which is weakening of the bones, or against bone fractures, such as hip fractures or vertebral fractures. One or two studies that suggest there may be some benefit, but the vast majority of the studies do not show benefit. And in fact, Harvard Nurses Health studies show that the women who consume the most milk had the highest risk of hip fracture. And if you look worldwide at dairy consumption is highest in those countries that have the highest incidence of osteoporosis and weak bones. So there is no real benefit for consuming dairy foods if your goal is calcium consumption. What's even worse is that whole milk is very high in saturated fat. It has proteins that have been shown to be linked to a number of cancers, and particularly in this country where the cows are artificially impregnated and treated with a variety of hormones, including growth hormone and so forth. The milk and dairy foods tend to be very, very high in estrogens, growth hormone, which increases the level of something called insulin-like growth factor, or IGF. Studies have shown that humans that have higher levels of IGF have a higher risk of the metabolic syndrome, chronic disease, but particularly cancers. The American Academy of Pediatrics recommends human babies not be exposed to cow's milk until they are more than a year of age, because there are many, many, many studies showing that early exposure to cow's milk for human infants increases their risk of iron deficiency anemia because of the proteins in the milk, but it also markedly increases their risk of developing type 1 diabetes. And type 1 diabetes is an autoimmune phenomenon where the body attacks the insulin-producing cells in the pancreas and kills them. Part of what happens is babies are born with an incomplete set of digestive enzymes. Proteins are digested by being cleaved by a suite of about 5 different digestive enzymes. If you have all 5 of those enzymes, you can then take any protein and break it down into all of its individual amino acids. One of the things that babies are supposed to get from their mothers is passive immunity, meaning that they are supposed to absorb antibodies in the mother's milk so that will help them ward off diseases that their immature immune systems haven't had a chance to react to. And the reason that they're able to do that is because they don't have all of their protein digesting enzymes. So instead of breaking proteins up into individual amino acids, babies break the proteins up into large fragments, and they are able to absorb protein fragments. That allows them to absorb their mother's antibodies intact. And certain genetically susceptible individuals, when they are exposed to bovine serum albumin, it's chopped up into protein fragments that when they're absorbed, the body recognizes this as a non-human protein fragment, and it makes antibodies against those cow's milk protein fragments. In certain instances, again, in these genetically susceptible individuals, if they have these antibodies to the cow's milk protein, if they get certain kinds of infections, those proteins will then attack their insulin producing cells and kill them, and they end up with type 1 diabetes. That's why it's recommended that you don't expose human infants to cow's milk until they have all of their digestive enzymes, and that means they have to be older than a year old. Very good reasons for never exposing your child to cow's milk protein. Then there's also the fact that cow's milk has been associated with exacerbation of problems like asthma and respiratory issues. That may sound odd to people. Well, why would milk cause respiratory problems? Any infant mammal comes into the world with a very immature immune system. So its mother's milk has to do several things. 1, stimulate it to grow. 2, also confer passive immunity while the baby's immune system is starting to rev up. But it also stimulates that baby's immune system. And when you think about the way that our respiratory tree keeps itself clean, it's through the production of mucus. Our entire respiratory tree is lined with mucus, which is designed to trap dust, bacteria, fungi, and not permit it to get down into the lungs. And we either cough it up and spit it out, or we swallow it, where the bugs are killed by digestive enzymes. And so one of the things that milk does is it helps rev up the production of mucus. Well, that's fine if you're a baby mammal and you need to get your immune system jump-started. But if you are an adult or a child who already has asthma or other respiratory problems like chronic sinusitis, that extra mucus production then causes you to have more asthma exacerbations, makes you more prone to getting respiratory infections and sinusitis. So that's that's yet another reason to avoid it. And there's also studies that link the consumption of dairy to acne in teenagers. That's probably through overstimulating their immune system, which causes them to have these breakouts. The data on the link between cow's milk and type 1 diabetes in children and iron deficiency anemia is solid and strong. I think that when you actually look at the preponderance of studies, most of them do suggest that there is a link between dairy consumption and ovarian cancer. Now, again, there are some studies that failed to show a link, but there's no study that shows that dairy foods are protective against ovarian cancer. So what you have is the possibility that consuming dairy foods raises the risk for ovarian cancer. And no, the link is not definitive, but there is evidence that there is a causal link. Why should women risk their lives ingesting material they don't need when there's a chance it could cause one of the most lethal cancers that can strike a woman? The vast majority of women who develop ovarian cancer die from it because by the time they become aware of it, it is already spread and it is very difficult to treat. You have a possible link between the consumption of dairy foods and a very lethal cancer on one hand and no real benefit on the other. So why would you play Russian roulette with your health? So that's, again, a good reason that I think women should avoid consuming dairy foods. In the United States, African-American men have more than twice the prevalence of prostate cancer compared to Caucasian men. And when African-American men develop prostate cancer, it is more aggressive, it is harder to treat, and it kills us much more quickly and much more often than the varieties that strike white men. There are very strong links between dairy consumption and prostate cancer. You know, my mother named me after her one and only brother, and my uncle died from metastatic prostate cancer. So this is something that hits me, right in the chest. Not only did it kill my uncle, but I have several good friends who've actually died in their 50s from prostate cancer. So this is no joke and it's nothing to play with. And in fact, if you read the China study, Dr. Colin Campbell showed that dairy protein was strongly linked to liver cancer in children. And it's been linked to a number of other problems, including multiple sclerosis and other issues. So dairy protein, not only is it not necessary, it should be avoided. To suggest that someone should drink milk to get their phosphorus, potassium, and magnesium is like suggesting that someone inhaled cigarette smoke to get oxygen. Yeah, there's oxygen in it, but there's a whole lot of other stuff that will harm you. And the same thing is true for the dairy food. Magnesium, phosphorus, potassium are widely available in all sorts of plant foods that have all sorts of nutrients and phytochemicals and other things that are good for you. You do not need to suck on the teat of a cow to try to get phosphorus. That's just the most ridiculous thing I've ever heard. What we call vitamin D is a compound that chemically is like 125 dihydroxycalciferol. It is a substance that our bodies will make when we have skin exposed to sunlight. The only reason that hormone started being called a vitamin was because early on the dairy industry began adding it to milk to make the consumption of dairy foods more attractive. So they put it in the milk and then they called it vitamin D. That would be like me putting testosterone in milk and calling it vitamin T. It's not a vitamin, it's a hormone. And it's a hormone, as I said, that all humans make when we have skin exposed to sunlight for significant periods of time. Granted, there is a problem for humans living in more northerly latitudes because of the temperate weather and the longer winters. We tend to be covered up and we tend to be indoors. So we don't get the sun exposure we need to make adequate amounts of the calciferol. But you can get so-called vitamin D supplement. You don't have to drink milk to get it. You can go to your drugstore and get your little bottle of vitamin D3, take it every day, and you're fine. And or if you are able to be out in the sun where you have your arms and torso exposed for at least a half an hour to an hour a day, depending on the latitude, you'll make your own. You don't need to ingest this unnatural compound just because they poured something in it to try and sucker you into getting it. Big selling point for the dairy industry, and when they try to push their products on people, is that, oh, it has calcium, it has calcium. Studies have shown that when a person drinks a glass of milk, they actually lose more calcium in their urine than they're able to absorb from the glass of milk. There's something called fractional absorption of a nutrient. Humans can only absorb 23 to 24% of the calcium that's in a given amount of milk. So that means that, yeah, you might have 300 milligrams of calcium in a glass of milk, but you're not going to absorb it all. You're only going to absorb absorb somewhere between 17 to 23% of it. And in fact, years ago, there was an attempt by the dairy industry to produce a protein-reduced version of milk in an effort to decrease the amount of calcium loss associated with drinking milk. That product, I don't think, ever made it to market, but it was a definite attempt on their part. And that shows that they recognize that the amount of protein in milk causes problems in terms of calcium balance, because we end up losing more calcium than we can gain. Cows don't drink milk, but there's tons of calcium in their milk. Where does it come from? It comes from the stuff they eat, the green leafy vegetables. If you take a 6-foot human being and take all of the flesh off, just take his skeleton, the entire skeleton in a 6-foot human being will weigh about 25 pounds. A full set of antlers on a mature bull moose weighs between 80 to 85 pounds. And they're made out of solid bone. And the animal produces it within 3 months, eating nothing but green plants. There's tons of calcium in plants. It is a giant myth that you can only find calcium in dairy foods. Calcium is widely distributed throughout the plant kingdom and readily available. And it comes along with a whole bunch of other things that are actually healthy for you, as opposed to, protein that damages your body and saturated fat that clogs your arteries and the hormones and the other things that are in dairy foods. So you do not need dairy foods to get your calcium. You can get it directly from the plants, just like every other large mammal on this planet.
Okay, so I hope you guys found this video valuable. I want to know, what do you think about dairy? Drop a comment down below. Give this video a like, share it around, and subscribe for more. In this video, we're going to talk about the truth on carbs and whether a low-carb diet.
Okay, screen share is over.
Okay, any
Thank you.
comments?
I thank you for that video. I really appreciate it. I saw on some commercial, or was it on Facebook or something, they were also talking about dairy foods, and they saying the best milk was not the almond milk, but they said coconut milk was the best one. I heard that somewhere. Darryl or Dr. Callender, you want to address that? Or none of it is any good? Almond milk, coconut milk. I know those are not really milks.
There's mixed data on coconut milk. There's mixed
Oh,
data.
well.
Some say mixed data on coconut.
Yeah, the mix comes from, if you add sugar to it, it's going to be bad for you. Unsweetened coconut milk is probably okay. The almond milk, that's a hybrid, and you've heard what I had to say about hybrids. Coconut milk is not a hybrid product.
What about silk milk?
I'm not familiar with silk milk.
How about oat?
It's on the bottom shelf at Shoppers.
Oats are also a hybrid, but okay, like oat, soy, oat, soy, and okay, they're hybrids, but they're plant-based, and so they're a lot better for you than animal milk that has lactose, like sheep, goat, or cow's milk.
Okay.
So, you call plant milk, you call it milk, but it's not really milk in terms of animal milk. So there's a big difference, even though you're calling both milk.
Okay, thanks. Any other comments or questions? Next week, I have an appointment. I'll be unable to participate next Thursday, but I'll be back after that.